All right, and we are live. Welcome, everybody. I'm Vince Revo, and welcome to another Brain Boost podcast. Today, we're going to be talking about 10 symptoms of ASD, autism, and how 40 hertz gamma light therapy can help. Now, this is not medical advice. This is for educational and informational purposes only. However, this is something that I've experienced extensively, and hopefully this information will help you. Now, if you're watching this video, then chances are that you have a relative, you have someone you care about, or you yourself have ASD or autism or on the spectrum. So we're going to talk about 10 symptoms, and this is and we're going to talk about the 40 hertz light therapy and sound therapy as well, and how it can help with some of those symptoms. Now, with people with autism, one of the major things that people notice almost right away is social communication challenges. And that is almost something that across the board you'll see. It's not that it's impossible. It's just it's that they have difficulty understanding and using verbal and nonverbal communications, such as gestures, facial expressions, and tone of voice. Now, it doesn't mean that they'll never be able to learn it, or that they can't communicate, or that they can't use gestures or even make facial expressions. However, in the onset of things, they can always learn that. But in the onset, normally you'll see, especially for a child, you'll see the difference between someone who has ASD autism and someone who does not have ASD autism, and the vast difference in understanding and using verbal, nonverbal communications, body language, facial expressions, and tone of voice. Another thing that we see sometimes is repetitive behaviors. So engaging in things such as just rocking or hand flapping or anything repetitive, just jumping up and down in a single place. You'll see that happen. It's a form of comfort. Now, again, it doesn't mean that they'll never get over this, but it is something that is triggered when there is they feel like, they need to defend themselves, or they feel attacked, or they feel overwhelmed, or sometimes they'll start using just repetitive words, right? They'll just keep saying something over and over and over again. They might say train, train, train. They just keep saying train over and over and over again while they're experiencing various emotions. There's also something, another symptom is resistance to change. It's very difficult to, let's say, change a schedule, or if something has been set in their mind and then you try and change that, that'll be something that they struggle with, and they'll get frustrated over. So anything changing in routine, environment, they prefer predictability. And when something is unpredictable and they're unsure of what will happen, sometimes that can be overwhelming as well. One thing that most people are aware of, one of the symptoms also, is sensory sensitivity. So either overreacting or underreacting to sensory inputs, like it may be sound, it may be light, it may be touch, it may be taste, it may be something that they smell, and it's something that repulses them or something that excites them, right? One of the myths with autism is that some people think that they don't have any emotions, and that's not true at all. They do have emotions. They can access those emotions, but oftentimes it's not in a way that quote unquote normal people would understand. So there is an overreaction or underreaction to sensory inputs. Also, we talked about this verbal. So there's also nonverbal communication difficulties. We're talking about body language. People with autism can make eye contact, right? They can learn how to make eye contact through various therapies, and they can learn to use facial expressions, right? These are things that they can learn. Okay, this is a socially acceptable facial expression. This is making eye contact is socially acceptable. And these are things that actually they can learn with the help of various different therapies. And also, they can understand body language, right? If you teach them it, and eventually they can form patterns in their brain and understand that, hey, okay, this is it. We're going to talk about also how 40 hertz light therapy can help them overcome a lot of these symptoms. Another thing is difficulty understanding emotions. So we were talking about how they do have emotions, but they may have difficulty understanding those emotions, right? So they may have difficulty recognizing or identifying or expressing those emotions, both for themselves and for others as well. Another thing is they have super hyper focused interest. One of the things that we'll notice sometimes for kids with autism, or even adults with autism, they'll love wheels or trains or planes, anything moving, mechanical, right? Engineering. Maybe they'll like to take something apart, and so they have these highly focused interest in specific subjects, in specific activities, and they can just lose their time in it because they really get absorbed in it, right? Another thing that we see is social withdrawal. Sometimes when there's too much sensory input, then you'll see them withdraw, right? One of the things that we saw with our kid early on was if it was way too noisy, he just want to kind of curl up, right? Or just cover his ears. Or sometimes in a party, if it was way too loud, we didn't realize that it was way too loud for him. He would just want to kind of be in the corner and just be by himself, right? So times when they just prefer to be alone, and they have, especially what we saw before we started doing the 40 hertz therapy, was really difficulty connecting with other kids, right? They just wanted to kind of be alone, and so forming friendships with peers, etc. That was difficult. Another symptom is cognitive differences as well, having differences in learning ability, attention, problem solving abilities. These can range from intellectual disabilities to above average intelligence, where they'll just be able to spot certain things, or they have supernatural memory. We've seen that as well, right? Or they can look at something and somehow their brain is just able to see something that others wouldn't be able to see. We also see one of the symptoms is cognitive delays, right? Delays in reaching certain milestones in motor, social, speech, nonverbal. And so there's all of these, and just to go over them again, there's the social communication challenges, repetitive behaviors, resistance to change, sensory sensitivities, nonverbal communication difficulties, body language, difficulty with understanding emotions, super hyper focused interest, social withdrawals, and then cognitive differences, and then finally developmental delays. Now, how does this help with that? Like how does this device, this 40 hertz device, help with that? Well, what happens is a few things. So one of those things we have in the notes below is enhanced brain synchronization. So studies have shown that 40 hertz lights can actually enhance the power in synchrony of the gamma brain waves and the gamma rhythms in the brain, which are important for, guess what? Memory, cognitive functions, executive functioning, and speech. So this enhancement potentially aids in improving attention and cognitive functioning in individuals with autism. And we'll look at this link right here. So as you see here, evidence early but emerging that gamma rhythm stimulation can treat neurological disorders. So could this be also for autism? Right here it says sensory stimulation has proven safe and well tolerated. Multiple sensory studies have measured increases in gamma power and brain network connectivity. Sensory studies have also reported improvements in memory and cognition as well as sleep. And we know that for people with ASD and autism, one of the difficulties is actually getting a good night's sleep, because that is when the brain is repairing itself. Now, we all know that when we don't have a good night's sleep, or we have multiple nights of terrible sleep, that our brain is not functioning to the best of its capability. So some have yielded apparent physiological benefits, such as reduction of brain atrophy. So what is brain atrophy? It's when you start losing neural pathways, and you start losing neuroplasticity. You start losing gray matter in the brain. In one case, and changes in immune system activity in another. Now, we know how important your immune system is for your body. Your brain also has an immune function. It has an immune neurofunction. And when that is not operating properly, then you start having certain neurological disorders. And it says here, the MIT team has been testing gamma stimulation potential to help with cognitive effects of chemotherapy or chemobrain. Now, again, that has something to do with the brain also. When you go through chemotherapy and that radiation starts zapping brain cells, right? Another thing is reducing sensory overload. So we know that with ASD, autism, they may be hypersensitive to noise, to sound, to taste, to smell, to touch. You'll see some kids with autism, like if you touch them, like they'll really react. Like some with sound, some with light, super sensitive to light. Now, what this will do theoretically is its effects on reducing the overload, the sensory overload, and the impact. We've seen that with Alzheimer's patients as well. It helps regulate the brain network. So the brain network connectivity, and by improving cognitive functions, it can actually normalize sensory processes, and it can help alleviate that hypersensitivity to certain sensory outputs. So there's this sensory overload, and we see that an overreaction or underreaction to sensory overload, and this potentially can regulate that. Let's read right here in this report. Evidence that gamma rhythm stimulation can treat neurological disorders is emerging. So we're seeing that more and more now. Lower range gamma frequency rhythms, those around 40 cycles a second or 40 hertz, are particularly important for memory processes. And MIT's research has shown that they also are associated with specific changes at the cellular and molecular level. So this is happening at a cellular and molecular level. And this is why one of the things that we always recommend is that this is used, right, daily. This is used every single day, because if it's not used every single day, then, at the molecular cellular level, that healing won't be taking place, right? Where are we now here? There's a few more notes here. Some have yielded apparent physiological benefits, such as reduction of brain atrophy in one case and changes in immune system activity in another. So that is huge as well. Most reports benefits to cognitions, executive function, and or memory, depending sometimes on the brain region stimulated. So this is stimulating certain parts of the brain. Like this light specifically is stimulating certain regions of the brain that are associated with cognitive functioning, executive functioning, and memory. And some have assessed that benefits endure even after treatment concludes. Some have shown effects on measures of tau and amyloid blood flow. So we all know how important brain blood flow is. Where are we here? Neuromodulatory chemical activity or immune activity. And we talked about this in the other Brain Boost podcast, but what this does is by stimulating this specific frequency in the brain, it actually activates the microglia. The microglia is the brain immune cell. It is the neuroimmune cell of the brain. It is what's doing the cleanup. It's what's getting rid of the plaques. It's what's getting rid of tangles. It is what is bringing healing to your brain. And this stimulates that. And maybe that's why these researchers have seen an increase in blood flow and neuromodulatory chemical activity or immune activity. Finally, it says here, a 40 hertz stimulation clinical study using TMS in 37 patients found improvements in cognition, prevention of brain atrophy, like what we talked about before, and increased brain connectivity. We all need increased brain connectivity. I know I do. So that's one of the things that I've noticed using this, right, is that it has definitely increased my brain connectivity. My memory has improved, and a lot of different executive functionings have improved for myself also. The field has generated tantalizing leads on how gamma stimulation may translate into beneficial effects on the cellular and molecular level. So this is happening physiologically, right? So this is what these studies are showing us. And like I said, it shows that your sleep improves. So if your sleep improves, naturally then your brain healing improves as well, because when you're in your REM sleep, that's when your microglia is activated. When your microglia is activated, then your brain is in healing mode, right? And so this is what is doing that. If this is activating your brain, then the immune cell in your brain gets activated, then your brain goes through a healing process. So the 40 hertz light therapy has shown promise in improving sleep consistency. And that is important, like what we wouldn't give for a good night's sleep. So given the common sleep disturbances in ASD autism, similar benefits might be observed also with that. And I think theoretically and hypothetically, that is what's happening. People with ASD autism are able to sleep better with this. Therefore, their brains are able to go through that healing process during the REM sleep cycle where microglia is activated. Here we have, again, another study where it indicates that in these clinical studies, we were pleased to see that volunteers did not experience any safety issues and use in our experimental lights and sound devices in their homes consistently. So these are the devices that the researchers used. This device has that exact frequency that they used in these studies. One of these tests, a phase 1 study, enrolled 43 volunteers of various ages. These are now human trials. And then there's a phase 2A pilot study. These are 15 people with early stage Alzheimer's disease in single-blinded randomized controlled study to receive exposure to 40 hertz light and sound. So also, if you're someone who has dementia or some kind of neurological disorder in your genome, right? Your family has had it, your father, your uncle, your mother, your sibling, your grandfather, your great-grandfather, then this could be used also as a preventative therapy, theoretically, for that, right? Where are we here? Measurements taken with EEG, so they actually scanned the brain, and we're looking at the brain waves. EEG scalp electrodes clustered at frontal and occipital sites showed significant increase in 40 hertz rhythm power at each cortical site among cognitively normal younger and older participants, as well as volunteers with mild autism. So this is the good news. This is not just for someone who has a neurological disorder. You could have, you might not have a neurological disorder, but maybe it runs in your family, it runs in your genome, and this can be used as a preventative measure because it works. It helps at the molecular level, at least what they found in this research, for normal, younger, and older as well, like normal brains, and also people with neurological disorders such as AD. Between the two volunteers with epilepsy, measurements showed significant increase in 40 hertz power in deeper brain regions such as the gyrus rectus, amygdala. Okay, pay attention to the amygdala because that's where a lot of trauma happens, right? And the amygdala is the emotional storage system, I think. So someone correct me if you're a neuroscientist or a naturopathic doctor. I was speaking with a naturopathic doctor, and one of the things that she mentioned was the amygdala and how this is able to reach those deeper regions of the brain. Now, the thing with like smart foods and smart vitamins and stuff like that is that it's very difficult to cross that blood-brain barrier. But this is non-invasive and it crosses that blood-brain barrier. So it hits the amygdala, the hippocampus, which is in charge of, hormones, and the insula. And guess what? With no adverse effects, including seizures. So this is including those who struggle with epilepsy. Phase 2A study, neither treated nor controlled volunteers reported serious adverse events. Both groups used their device 90% of the time. The 8 volunteers treated with 40 hertz stimulation experienced several benefits that reached statistical significance compared to the 7 volunteers in the control. So what this means is that those that were using this type of therapy, this specific frequency, experienced benefits, and the controlled study that weren't using this did not experience those benefits. Treated patients did not experience significant changes in these measurements. So they're talking about reduced volume of the hippocampus and increased volume of open spaces or ventriloquils. Treated patients also exhibited, pay attention, better connectivity across brain regions involved in the brain's default mode and medial visual networks, which are related to cognitive and visual processing, respectively. Treated patients also exhibited more consistent sleep patterns than control. Again, we're seeing studies showing that, hey, you'll sleep better with this as well. Cognitive functions improve with this as well. And finally, let's go through this study. We won't be able to go through all of it. We're already 21 minutes in here. But let's go through this. It leads to cognitive and behavioral improvements, specifically in spatial and recognition memory. The same group found that auditory stimulation reduces p-tau tangles in the P301S mice models with effects across multiple cell types, i.e. microglia, astrocytes, and vasculature. So this is, we're seeing at a molecular biological level and a neurological level benefits of this. Interestingly, the number of localizations exhibiting entrainment increased with light intensity. So what that's saying is the brighter this goes, right, the more intensity that's happening in the brain. Now there's a few brightness levels of this. So you can see there's several different brightness levels, and that allows someone to just kind of get used to it, right? We always started at the lower level, and then as it goes on, you can kind of tolerate the higher level. Actually, right now in front of me, I have it constantly on when I'm at my computer. So where are we here? Interestingly, the number of localization exhibiting entrainment increased with light intensity with the largest aptitudes in the primary visual cortex. Despite inter and intra-individual variability, brain response to high-intensity 40 hertz was widespread, with 35 to 75% of the electrodes showing entrainment and few electrodes exhibiting entrainment in temporal lobes, the most crucial area for AD pathology progression. And when you talk about AD pathology progression, this is also the same areas like the amygdala, where a lot of other neurodegenerative disorders are based in as well. That's where the foundation is. And that's why this we're seeing kind of across the board, it's helping a lot of different neurological disorders. On the other hand, long-term exposure to 40 hertz visual stimulation and the consequent gamma entrainment with visual cortex poses some health-related risks for neurological patients. For instance, so this is a 2017 now, reported images eliciting gamma elicitation in the visual cortex are more likely to provoke seizures or pre-seizure activity in patients with photosensitive epilepsy. So if you have photosensitive epilepsy, then this you have to watch out for this, okay? Because it may trigger that. There's some people who are so sensitive that they'll go outside and they'll see police sirens and they'll have an epileptic seizure. So this is in 2017 that it may induce that. So this is very important for anybody suffering from that. If you want to use this type of therapy, if you suffer from epileptic seizures, use with caution. Maybe, if you want to give it a go, talk to your doctor, start at a super low dose at, when it's super light, and then, go from there, try and increase the dosage, go from there. But again, this is not medical advice. Talk to your doctor, especially if you're suffering from that, because, this is what they found in 2017. However, performing a cognitive task during the 40 hertz session improved the strength and extent of the gamma entrainment, even in the temporal cortex, as compared to stimulation with no concurrent cognitive task. This condition promoted the propagation of gamma entrainment to deep areas, including, again, hippocampus, exerting a key role in AD neuropathology. So hippocampus, again, in charge of a lot of things happening in the brain. We won't have really time to go through the genus mechanisms of this. However, at the end of the day, it's worth a try. This is by far the most affordable device that has been tested on the market. Other ones are probably 3 times the price of this. This is also portable. It's battery powered. It is patented. And if you would like to take a look at it, go and visit ediblelights.com or gammacure.com. With that said, I hope that this information has helped you out, especially for any of you who have someone in your family suffering from ASD or autism. I know what that's like. I have a video about it, talking about how my experience with my son and seeing the improvements that's happened in his life by using this type of therapy with him, the improvements that we've seen in our friends, in my personal, with my wife. We've all seen it. And so it's worth a shot. There's so many other therapies out there that cost so much. This is non-invasive. It is a fraction of the cost of the other therapies. So why not try it? So there you guys have it. I hope that this has informed you. If you have any questions, please let us know in the comments down below. And until next time, I hope you have a wonderful day. I hope you have a wonderful evening or wonderful afternoon, wherever you are in the world. And until next time, this is Vince Revo here at the Brain Boost podcast, wishing you well. And I hope that through this, that you will have better memory, better brain health, and it is possible. Not many people know about it, but it is possible. Until next time, we will see you again. Thanks for joining us, and bye for now.